Cardiovascular disease remains the leading cause of death in people with diabetes, and hypertension is a major risk factor. Hypertension increases the risk of atherosclerotic cardiovascular disease, such as heart attack and stroke, as well as heart failure and microvascular complications, such as kidney and eye disease. Early detection and treatment of hypertension can prevent life-threatening events and improve long-term outcomes for people living with diabetes. To help you achieve these outcomes, the American Diabetes Association's Standards of Care in Diabetes includes the algorithm entitled Recommendations for the Treatment of Confirmed Hypertension in Non-Pregnant People with Diabetes. This clear, evidence-based algorithm guides your treatment decisions and helps you evaluate medication tolerance and monitor for complications. Confirmed hypertension is defined as a systolic blood pressure of 130 or higher, or a diastolic blood pressure of 80 or higher. This diagnosis is based on 2 or more measurements obtained on separate occasions. Individuals with cardiovascular disease and a blood pressure greater than or equal to 180/110 could be diagnosed with hypertension at a single visit. Once hypertension is confirmed, initiate lifestyle management and pharmacologic therapy. Lifestyle management is important and includes counseling on weight loss when indicated, diet, sodium reduction, moderation of alcohol intake, smoking cessation, and physical activity. These lifestyle interventions are reasonable on their own for individuals with diabetes who have mildly elevated blood pressure, defined as readings above 120/80, but should be initiated alongside pharmacologic therapy when hypertension is diagnosed. If blood pressure is greater than or equal to 150/90, consider 2 agents or combination therapy. Next, assess for comorbidities, such as albuminuria or coronary artery disease. This guides your first choice of agents, with preference for an ACE inhibitor or an ARB. Monitor blood pressure regularly. If the target of less than 130/80 is not achieved, intensify therapy by adding or adjusting medications. Evaluate for medication tolerance, side effects, and adherence. Reassess blood pressure regularly, for example, every 3 to 6 months or earlier. Always involve the person you're treating in shared decision-making. Tailor treatment goals based on cardiovascular risk, comorbidities, and their preferences. As always, use clinical judgment when considering recommendations. Effective hypertension management is key to reducing cardiovascular risk in people with diabetes. Download the ADA's Standards of Care app today to access the interactive hypertension algorithm and stay current with evidence-based guidance.